I actually trained as a labor economist, and I did my thesis on collective bargaining and worked on collective bargaining for about 5 years. And I just got tired of it. So I decided to think about what problems I thought were the most important and that I wanted to work on child development and the health of children. So my first project in that line was actually looking at the effects of welfare payments on families. And I got frustrated with that because I thought, well, it's kind of like looking for a needle in a haystack. If you give money to a family, it could have any number of effects on children, and so you don't know what outcome you should look at. So then I thought it would be more interesting to look at a program where we had an intention of what we were trying to affect. So if you have a nutrition program, then you hope to improve nutrition. If you have a medical program, you hope to improve medical care. So I started looking in that direction and ended up as a health economist. Well, health is obviously a multidisciplinary topic in itself, in the sense that we usually think about health from a very medical point of view. When you say health, people think about health care and going to the doctor, going to the hospital. But most of the things that affect health really don't have anything to do with medical care. There are things like nutrition, family circumstance, stress, violence. These are all things that have profound effects on health. So basically, just by studying health, you need to know something about a very wide range of things that might have an impact. So the Center for Health and Wellbeing is the reason why I came to Princeton, because I was very interested in what they were doing. They do have a multidisciplinary approach. Historically, a lot of the collaboration was between psychologists and economists. So we had Danny Kahneman, the Nobel Prize winner, and now we have Angus Deaton, who won another Nobel Prize in economics. But there's a lot of people from other disciplines who are also represented: anthropologists, sociologists, political scientists, people in molecular biology, even in engineering. So they're all united by an interest in health. They all have different approaches, and sometimes that results in collaboration in research, but more often I think it results in people just having conversations that they wouldn't have had otherwise. We just completed a conference called Modern Plagues on lessons that we could learn from Ebola. And I think it was quite an unusual conference in that we had scientists who were studying the virus and studying vaccines, and we had anthropologists talking about what went wrong with the efforts of the international community to intervene. We had political scientists talking about why it was so difficult to work through the governments of that region. And so the multidisciplinary approach is really important to thinking about something of that magnitude. At least physiologically, I think the state of health of the mother before she gets pregnant probably has an impact on the child. But we don't have a lot of evidence for that yet. So mostly we study the period of pregnancy and afterwards because it's easier to measure what the timing of the effect is. One of the areas that I'm the most interested in working on just at present is mental health. Again, this is something that's a very big problem in many countries. We used to think that children, aside from really extreme cases, that children didn't really have mental health problems. They didn't become depressed, and so on. And many conditions were only diagnosed for people once they became adult, even though it's sort of obvious that they must have roots in childhood. So thinking about the right way to treat or prevent childhood mental health problems is a really important question. it's also one where, again, we used to think that, well, in developing countries, people don't really have these problems for whatever reason. And now I think people are starting to recognize that, well, actually there are quite a number of people in developing countries who have post-traumatic stress syndrome, who have depression, who have all these problems, and that maybe those are an important barrier to development. And so I think it's really a worldwide problem that's very important to study, and so I'm trying to work more in that area.